Shashank Joshi. Good evening, everybody. I am Dr. Shashank Joshi. You are watching the Dr. KK's Med Talk live show right now, which is the 584th episode. Let's have the headlines for the day. So we all know that the third wave is on the decline in large geographies across India. We know the active COVID cases are now 0.99% of the total infections, with a national recovery rate of 97.82% as per the Union Health Government data. We know that Mumbai is in a green zone. Delhi is now in a green zone with COVID in all its districts reporting a weekly test positivity rate less than 5%, with overall a weekly positivity rate of 2.2%. We know the national daily positivity rate is 2.23% with a weekly positivity rate of 3.63%. The ninth round of genome sequencing from Mumbai has shown out of the various samples that 95% of tested samples are Omicron. The DCGI expert committee has just given approval for Corbevax for adolescents between 12 to 18 years. And this is the another COVID vaccine being approved for ages above 15. Sweden has recommended a fourth vaccine shot for people above 80, people living in nursing homes or people who are having assisted living services. The second booster dose has to be administered at least 4 months following the first booster, either of an mRNA Pfizer or a Moderna, again as recommended as a booster. So today's topic is living COVID-19 in safe world, and we also are going to talk a little bit on doxycycline. Before I come to the topic per se, let me introduce my good friend who is joining us live, and it's very late in midnight in Australia, Dr. Rahul Pandit. We know Professor Rahul Pandit is a world famous COVID expert and a world famous critical care expert from India and Australia. He is the chief of critical care in Mumbai Fortis and the whole Fortis group. And he's been a pioneer, has been on the national as well as state task force for COVID-19. So let us go back to our drawing board. Rahulji, how do you view? Is the worst of the third wave over? Is there going to be any tail? Is there going to be any residue? And are we really seeing resumption of normalcy the way they are seeing in Europe?
Good evening, sir. Professor Shashank Joshi, renowned endocrinologist, Padma awardee, my elder brother, who has had number of publications, more than 700 publications now under his belt, and it's indeed a pleasure to be doing this show with you. So the way I look at this scenario, sir, it is a fractured scenario right now. Yes, there is no doubt about it that the patients who are symptomatic and who are seeking or requiring admission have gone down considerably. I have no doubt about that. But whether the same can be said about patients who are not having any symptoms, or rather what we call them as asymptomatic or not, I don't know. So yes, for the sake of understanding, for the sake of numbers, the third wave has certainly gone down. We need to be vigilant of this fact that there might still be a lot of patients who are asymptomatic and who are around in the crowd, in whom we may still see some amount of transmission going on. Whether we can go back to normalcy or not, I think the definitions of normalcy have to be changed. The definition of normalcy will always be now with COVID appropriate behavior. So the answer for that in long and short is yes, we need to go back to normalcy with COVID appropriate behavior. We cannot keep the COVID appropriate behavior away. It does not mean that you don't have to wear a mask. It does not mean that you don't have to sort of still try and maintain social distancing and air circulation. All of these things have to be continued, and only then we can say that we have come up to a point where we are now starting to live with the virus. And that's where we are currently. Sir, I have a question for you. And Krishna Kumar Mishra ji has asked this question. What is the prediction for the next or the future waves? Are we going to get another Omicron type of a variant? Or this is the end of the variants and we will not get any further variants? Where do you see this going?
See, Rahul ji and Mr. Mishra ji, after so many years of more than 100 years of flu or the Spanish flu, we still get flu pandemics. It's a fast mutating virus, the flu virus. And we have a flu vaccine now, but it has become endemic. Similarly, COVID is a slow mutating virus. The worst is over, so we are unlikely to get Delta-like variant, but we don't know. It's predictably unpredictable. We might get a more contagious but a less virulent strain, but that probability is getting lower and lower and lower as the virus evolves. So low probability of a disruption due to COVID. Also because the human host is either been naturally exposed to the antibodies or has got vaccine-induced antibodies or a little bit of both. So likelihood of deaths are zero or minimalistic. Likelihood of severe disease is less. For the next 6 to 9 months at least, even if there is active virus in circulation, a large major outbreak, at least in the geography of India, is unlikely unless a new variant of concern, which is more virulent and more contagious, comes. The likelihood of the variant being more contagious is there, but likelihood of being virulent is less likely. So if you ask me, the worst is over. If you ask me, disruption-free life and living with COVID will be a norm, but we can't be complacent कि COVID खत्म हो गया. COVID is very much around. COVID will be around, and we will have to treat it like an endemic disease once WHO declares it that the COVID pandemic is over. That's number one. Number two, we'll still need masking in indoor, closed, crowded environments. Outdoor masking, Europe has done away with it because they don't crowd and congregate. But in India, outdoor masking also will continue for the next couple of months. So we'll have to continue COVID appropriate behavior and live with COVID. And disruption-free COVID is a reasonable possibility in this year and next year, except maybe one disruption which may occur 6 to 9 months. But this is all speculative. We are, as scientists, we should not speculate. There is no evidence to suggest, but the current data is pretty compelling that the worst is over. And I think resumption of economy, resumption of economic livelihood, resumption of education, resumption of normalcy of life is very much possible with vaccine, mask, and COVID protocols. That's where I feel things are. And that's why, Dr. Pandit, I would like to ask you this question, that you are in another country called Australia. They had one of the most harsh lockdown. In fact, Australia is virtually locked down from the world for almost 2 years. How are they managing it? And what is your thinking of the so-called fourth wave? Will it really come? And do you really feel what has to be done? And Krishna Kumar Mishra has another question which I would like you to answer. Why are not we going the UK way?
Okay, so I think we'll take one question at a time, sir. What do I think of the fourth wave?
थोड़ा राष्ट्रभाषा में आप बोलेंगे. अश्विनी गुप्ता जी का एक दरख्वास्त है कि राष्ट्रभाषा में बोलेंगे तो थोड़ा ज्यादा सही रहेगा.
चलो कोई बात नहीं, राष्ट्रभाषा में बात करते हैं. आपने एक सवाल पूछा कि क्या चौथी लहर कोरोना की फिर से आएगी क्या. इसके बारे में मैं आपके मतों से पूरी तरह से सहमत हूँ कि शायद जो है अगर वायरस का फोर्थ वेव आ भी गई तो भी हमारी जो रोजमर्रा की जो जिंदगी है उसमें कोई रुकावट नहीं होगी. और इसीलिए मैं फिर से दोहराना चाहूंगा कि हमारी जो जिंदगी है उसको हमको इस तरह से मोल्ड करना है कि कम से कम अगले 6 से 8 महीने इस साल के अंत तक हम लोग कोविड अप्रोप्रिएट बिहेवियर को जो है पूरी तरह से पकड़ के रखें, उसको छोड़े नहीं. अगर हम ये पूरी तरह से पकड़ के रखेंगे तो हमारे रोजमर्रा की जिंदगी में रुकावट नहीं आएगी. सिर्फ हमको मास्क जो है वो पहनना पड़ेगा और कुछ नहीं है. दूसरा सवाल आपने पूछा कि क्या हम लोग यूके की तरह जा सकते हैं, कहाँ पे हमारा जो है किस दिशा में हमारा जो है कोविड अप्रोप्रिएट बिहेवियर को लेके आगे बढ़ना है. तो मैं ये कहूँगा कि यूके ने जो किया है उसके और हमारे बीच में बहुत अंतर है. सबसे पहला अंतर यह है कि यूके में करीब अभी 90% पॉपुलेशन ऐसी है जिनका कि पूरा वैक्सीनेशन हो गया है और करीब 75% पॉपुलेशन ऐसी है उनको की बूस्टर डोज भी मिल गया है. अभी हमारे देश में और यूके की पॉपुलेशन में बहुत फर्क है. यूके की पॉपुलेशन 6 करोड़ है, हमारी आबादी जो है वो 135 करोड़ से ऊपर है. हम अगर ये करना भी चाहे तो हमारे लिए जो है वैक्सीनेशन का स्टेटस पूरा होना बहुत जरूरी है। एक दूसरी बात यह है कि किसी ने किया और उसको हम फॉलो करें, ये बिल्कुल जरूरी नहीं है, क्योंकि वो सब बहुत इजी लगता है। आज तक जो भारत ने करते आए हैं, हमने इस कोविड को जो है, भले ही लोग इसके बारे में नहीं माने, पर 135 करोड़ प्लस के आबादी वाले देश ने जो इस तरह से कोविड का जो सामना किया है, कोविड को जो हमने पीछे ढकेला है, हमारी जो इकोनॉमिक ग्रोथ चालू है अभी भी, मेरे ख्याल से दुनिया ने एक्चुअली हमारे तरफ देखना चाहिए कि हमने कई कई जगह पे लॉकडाउन रखे, कई कई जगह पे रिस्ट्रिक्शंस रखे, थोड़े बहुत जो है पाबंदियां रखी हमने, पर वो पाबंदियां जो थी वो लोगों के हित में थी। पाबंदियां जो थी उस वजह से जो है आज हम ये इकोनॉमी और आगे बढ़ा पा रहे हैं। इतने करोड़ों के लोगों में संख्या में लोग पॉजिटिव नहीं आए हमारे पास। हाँ, आप ये कह सकते हैं कि काफी लोगों ने टेस्टिंग नहीं की थर्ड वेव में, पर ये भी उतना ही सच है कि हॉस्पिटल से बाहर नहीं पड़ा है। जो कि इस वक्त इस यूके में, मैं भी इस वक्त ऑस्ट्रेलिया में हूँ, ऑस्ट्रेलिया में भी आज भी आईसीयू जो है भरे हुए हैं, पेशेंट जो है एडमिट है। तो ये इस देश की पॉपुलेशन है करीब करीब 22 करोड़, सॉरी 2 करोड़ 22 मिलियन, 2 करोड़ 20 लाख, 2 करोड़ 20 लाख की पॉपुलेशन को ये लोग जो है संभालते संभालते इनके आईसीयू भर गए हैं। हमारे 135 करोड़ के पॉपुलेशन को संभालते हुए भी हमारे पास इस वक्त थर्ड वेव में काफी सारे बेड्स खाली थे। अधिकतम शहरों में लोग जो थे बेड खाली थे। और आखिरी आपने जो सवाल किया था कि हम कहाँ पे, ऑस्ट्रेलिया में कैसे मैनेज हो रहा है। ऑस्ट्रेलिया में जो है, अगेन यूके जैसा प्रगतिशील देश है। जब मैं कहूँगा कि थोड़ी बहुत एजुकेशन लेवल और ये बहुत ज़्यादा है यहाँ पे, तो लोगों का थर्ड डोज वैक्सीनेशन जो है काफ़ी लोगों का हो चुका है। इंडोर में मास्क पहनते हैं, आउटडोर में ऑप्शनल है। ऐसा नहीं बताया कि मत पहनो करके, ऑप्शनल रखा है। पर मैं अगर सड़क पे चलूँ तो अधिकतम लोग जो है मास्क पहनते हैं, और वो पूरा मास्क पहनते हैं, सिर्फ नाम के लिए मास्क यहाँ पे नहीं रहता है। तो मेरे ख्याल से हमारे लिए जो है ये मास्क पहनना बहुत ज़रूरी होने वाला है। सर, आखिरी जो अभी सवाल अश्विनी जी ने पूछा कि हमारी खुद की वैक्सीन बढ़िया है, इससे इसके लिए हम बचे हुए हैं। तो ये जो नए वैक्सीन जो कोरोनावैक्स आई है, अभी कल ही उसको आज ही सुबह मान्यता मिली है था एक्चुअली। मैं थोड़ा आगे चल रहा हूँ तो मैं कल की बात कर रहा था। तो इसके बारे में आपका क्या ख्याल है? इतने सारे वैक्सीन भारत ने मान्य कर दिए हैं, इसके बारे में क्या ख्याल है? और दूसरा मेरा सवाल रहेगा कि आज भी अगर आप जनरल प्रैक्टिशनर्स के पास जाओ तो एक दवाई जो है उसके बारे में बहुत विश्वास है लोगों का, वो है डॉक्सीसाइक्लिन। तो इस वक्त डॉक्सीसाइक्लिन का हम कहाँ पे रोल देखते हैं, इसके बारे में थोड़ा सा इलैबोरेट कीजिए सर।
तो राहुल जी, आपका पहले प्रश्न का उत्तर दूंगा मैं। अश्विनी जी ने जो प्रश्न पूछा है कि भारत वंश में बने हुए भारतीय वैक्सीन जो है, जैसे कोवैक्सीन है और बाकी अलग अलग वैक्सीन जिनको हमने अंतरराष्ट्रीय कोलैबोरेशन के साथ बनाए हैं, जैसे कोविशील्ड हो, कोर्बेवैक्स हो, कोवोवैक्स हो और स्पुतनिक हो, ये सब वैक्सीन में क्षमता है, इम्यूनिटी बढ़ाने की क्षमता है, बच्चों में देने की क्षमता है। जाइडस कोविड का डीएनए वैक्सीन है। भारत वंश का भी नया एमआरएनए वैक्सीन जो पुणे में बन रहा है, वो भी लगभग उसकी रिसर्च पूरी तैयार है अप्रूवल के लिए। तो भारत में जो प्रिडोमिनेंट वैक्सीन दिया गया लोगों को, वो था कोविशील्ड और उसके बाद था कोवैक्सीन, और कोवैक्सीन के भी नेजल स्प्रे भी आ रहा है। तो हमारे जो भारत वंश में नेचुरल एक्सपोजर भी बहुत बड़ा हुआ दूसरे लहर में और तीसरे लहर में। और दूसरी बात यह है कि इसके साथ ही हमने और एक चीज देखी कि उसके साथ ही वैक्सीनेशन की प्रमाण और मात्रा पहले डोज की लगभग 95% प्लस हुई है और दूसरे डोज की भी लगभग 75% के ऊपर हुई है। तो भारत वंश बहुत आगे है वैक्सीनेशन में। और प्रिकॉशनरी डोज और बच्चों के 15 से 18 वय आयु के में भी वैक्सीनेशन की गति लगभग बहुत ज्यादा है। तो इसमें कोई दो राय नहीं है कि हम काफी आगे हैं, दुनिया से भी हम काफी आगे हैं। आपने दूसरा प्रश्न पूछा कि डॉक्सीसाइक्लिन या एंटीबायोटिक है, ब्रॉड स्पेक्ट्रम एंटीबायोटिक है। अभी सर्दी का मौसम होने के कारण, बिकॉज इट्स कोल्ड सीजन, काफी हम देख रहे हैं कि इन्फेक्शंस होते हैं। तो कोविड और नॉन कोविड दोनों के सेकेंडरी इन्फेक्शंस में डॉक्सीसाइक्लिन का महत्वपूर्ण योगदान है और दिस मेडिसिन कैन बी गिवन। सो दैट इज एज फार एज डॉक्सीसाइक्लिन इज कंसर्न। कोविड में हमने 3 चीज सीखी है। पहले यानी कि दवाइयों में कंटिन्यूअसली बदलाव आते गए हैं, और अभी जो कोविड है, कोविड हैज 3 पार्ट्स। नोज कोविड यानी नाक का कोविड, दूसरा कोविड है थ्रोट का कोविड, तीसरा कोविड है फुफ्फुस का कोविड। पहले 2 लहर में जो कोविड आया था वो तीनों को इफेक्ट करता था, फुफ्फुस या लंग को इफेक्ट करता था, इसलिए वो जानलेवा था। अभी आने वाला जो स्ट्रेन है वो प्रिडोमिनेटली नाक और थ्रोट में आता है, वहां पे सेकेंडरी इन्फेक्शन होने की संभावना रहती है, इसलिए कभी कभी हमको डॉक्सीसाइक्लिन जैसे एंटीबायोटिक देने की गरज पड़ सकती है। इसलिए हम उसके ऊपर थोड़ा स्पष्टीकरण देना चाहते हैं। फुफ्फुस में कोविड जब होता है तो वहां पे ऑक्सीजन सैचुरेशन, ऑक्सीजन, स्टीरॉयड और हॉस्पिटलाइजेशन ये सब करना पड़ता है, जो डॉक्टर पंडित के हॉस्पिटल में होता है। लेकिन अधिकांश जो लोग हैं वो लोग अभी घर में ही अपनी आप की ट्रीटमेंट कर रहे हैं। सो मोस्ट पीपल आर बीइंग ट्रीटेड एट होम, and whenever there is a doubt for a second infection, there is a role of doxycycline. It's a very large, broad spectrum antibiotic. So clearly that is very much there. So Dr. Pandit, I have 2 questions for you. You work in ICU situations. You know there is something called as antimicrobial resistance. Doxycycline is a very old antibiotic. So how do you see its role in the ICU setup and hospitalized setup? That's number 1. And number 2, what is your comment on rational use of antimicrobial therapies? Because that has been a huge concern, and you lead a group in your hospital system about antimicrobial resistance. See, there are concerns related to viral resistance, but more than the viral resistance, it is antimicrobial resistance which is a big concern, because we will get drug resistant microbes, and they can be a huge concern for the rest of the world. So Rahulji, can you give us some insights, and
Yes.
then maybe get a contextualization on doxycycline, how a old is gold, you know, it's like old wine in a new bottle, how some of these old age drugs still are impactful, effective, and can overcome some of these AMI problems.
Yes. So, sir, absolutely right. I think it's very, very pertinent that we talk about antimicrobial stewardship program. Now, what does antimicrobial stewardship program mean? Antimicrobial stewardship program means right antibiotic at the right time, at the right dose, for the right duration, with the right route. These are the 5 main magical pillars. That means if you don't need antibiotic, you don't need to give antibiotic. Right antibiotic means you look at the syndromic approach and give the antibiotic which is most likely to either cover the infection, or you already have a culture which tells you which antibiotic to use. Right time, you should be starting the antibiotic as quickly as possible when you suspect infection. Specifically, if you have septic shock, for every 1 hour delay in giving appropriate antibiotic after septic shock, onset of septic shock, the mortality increases by 7%. So right time is very, very important. Right duration, you need to understand that the dose and duration are the 2 main things of the pharmacokinetics and pharmacodynamics of a drug. You need to give full doses at least for 24 hours to 48 hours initially, and not worried about renal toxicity or renal clearance or hepatotoxicity or hepatoclearance, because for the first 24 hours you require the drug to reach to a minimum inhibitory concentration. Now, different drugs have got a minimum inhibitory concentration, means the minimum amount of concentration of the drug which will be required in the blood to inhibit the growth of further bacteria. That MIC level has to be put to be reached, and to reach to that MIC, you need to give them an adequate dose. Only then the drug will be effective. And the last is duration. You have to give it for an appropriate duration, not prolong it beyond a certain time, not shorten it beyond a certain time. Most infections are easily treated with 5 to 7 days of antibiotic. Some infections which are there in the brain, in the abdominal cavity, in the lungs, may require around 10 days of therapy. Bone infections or fungal infections, the protocols are different. Bone infections may require up to 6 weeks of therapy. Fungal infections would require 14 days of therapy after last negative blood culture. Those kind of things are required. So blood in the fungus, you require to wait for at least 2 weeks after the last negative blood culture. And most importantly, what antimicrobial stewardship does is it does not allow you to prescribe unnecessary antibiotics, thereby preserving the sensitivity of that drug. It allows a uniform antimicrobial flora in your hospital, and it does not actually allow a lot of resistance to come in. And this is where doxycycline has been good. Doxycycline is a drug which belongs to tetracycline group. Unfortunately, it does not have a very good penetration in the urinary system. However, it has got a very good penetration in the lungs, very good penetration in other soft tissues as well, and I think it can be used very nicely for these infections: skin and soft tissue infection, lung infection, intra-abdominal infection, infection with multi-drug resistant organisms like Acinetobacter baumannii. We are using doxycycline in combination with other antimicrobial agents to treat these multi-drug resistant organisms through intravenous route as well. So there is the intravenous route as well as the oral route which is available now, and we should be using them to try and get effective control of these organisms. I think this is where doxycycline and our antimicrobial stewardship program goes. Sir, Karuna Pramod is asking a question. ओमाइक्रॉन का अंत जल्दी खत्म हो रहा है, आतंक जल्दी खत्म हो रहा है. इट इज इट बिकॉज ऑफ वैक्सीनेशन? आई एम एंशियस टू नो कि जब वैक्सीनेशन कर का असर समाप्त होगा तो क्या वापस लहर जैसी कोई स्थिति बन सकती है क्या?
करुणा जी, आप बहुत सही प्रश्न पूछा आपने, और आपके प्रश्न में बहुत कुछ बोला है कि ओमाइक्रॉन का अंत जल्दी हो रहा है, क्योंकि जितने जल्दबाजी में वो आया उतने ही जल्दबाजी में उतर रहा है, और उसके ऊपर वैक्सीनेशन और जूने इन्फेक्शन का जरूर इम्पैक्ट था तीव्रता कम कर रखने में. और जैसे ही ये वैक्सीनेशन का इम्पैक्ट एक 6 महीने 9 महीने में कम होगा, वापस दूसरा नया स्ट्रेन आएगा तो इम्पैक्ट हो सकता है. आपकी बात में थोड़ा साइंटिफिक बेसिस है, लेकिन कैसे है कि अभी जो हमारी जो करंट लहर है ये लगभग बड़े बड़े शहरों में खत्म हो चुकी है. हमको सावधानी बरतनी चाहिए, घबरा नहीं चाहिए, अभी भी मास्किंग रखना चाहिए, पर्टिकुलरली क्लोज्ड एनवायरनमेंट्स में, क्लोज्ड इंडोर स्पेसेस में, और वैक्सीनेशन की एक्स्ट्रा प्रिकॉशनरी डोज जिनको जिनको एलिजिबल है उनको देते रहने चाहिए. आपने देखा कि यूरोप के अधिकांश कंट्री में और अमेरिका के अधिकांश लोगों ने एक्स्ट्रा बूस्टर डोज जरूर लिया है. तो अगले साल, ये साल में हमको एक्स्ट्रा डोसेस लगाने पड़ेंगे. उसका इंडियन साइंस अभी जनरेट हो रहा है और इसके बारे में ज्यादा जानकारी आती जाएगी. राहुल जी, अभी आई विल आस्क द लास्ट क्वेश्चन to you before, and you can give your summary remarks as we are nearing the end. Ki, are we now at the end of the pandemic and are we going to become endemic? That is what Gauri Bhumkar is asking. And whoever got infected in the third wave, have they got natural immunity only to Omicron, or is it Omicron and Delta, and how long will that immunity last?
I think it's a very interesting question. So first and foremost, I think we are definitely heading towards endemicity. Whether it is now or whether it is down in the next few months, I think we need to wait and see. But no doubt about it that we are heading towards endemicity. Regarding the second question, that once we have an Omicron variant in the third wave, which has been infecting us, are we going to get an immunity across all spectrums of all variants of COVID-19 virus, or is it going to be something which is very specific for Omicron, and how long will it last? I think how long will it last is a very difficult question to say. Maybe somewhere between 1 month to maybe 3 to 4 months. I think that's what I would say is going to be the best answer. There is a lot of immune escape seen because of the spike protein mutation, and because of which it is unlikely that you would get immunity for all variants of COVID-19. You would definitely get it for some, more likely than not for Omicron. But there are talks about Omicron being reinfecting as well. And I believe that we need to be very careful and at the same time vigilant to make sure that we don't allow this virus to come back again. My ending remarks before I hand over back to you, sir, for your closing remarks would be that yes, we are in a very happy space right now. As a country, we are down to 33, 34,000 infections. As Maharashtra, we are down to below 2,000 infections. Mumbai and Delhi are now reporting test positivity rates in decimals. I think this is the time to consolidate and not let our guard go down. This is a kind to take our economy forward with COVID appropriate behavior. This is the time to take vaccine and not hesitate to take the vaccine. And most importantly, don't forget that COVID can be just around the corner. So keep yourself vigilant and ready to face any other problem which may unexpectedly come up. With this, I hand over back to Professor Joshi for his remarks on this.
So thank you, Rahulji. Praveen Chogule, is there a chance of a fourth wave? Very low probability after 6 months to 9 months, if there is a new variant of concern. Ganesh Ambor is asking, is a booster dose necessary? Currently, precautionary dose is necessary for frontline workers, healthcare workers, and people above 60 under medical supervision. And below 60, also a guidance will come if you are having underlying comorbidities or you cannot mount a immune response. So ask your doctor for the same. Yes, we are at the end of the end game of the current pandemic, and we are waiting for these numbers to be stable for the next 2 to 3 months for WHO to call the end of the pandemic across the world. We have to continue our vaccination and masking. That ending is unlikely, and COVID will become endemic in the second half of the year, is our hope, wish. And we have to live with COVID with smile, without anxiety, with a lot of cheer and positivity, without being reckless and stupid. And I think we have to learn how to handle diseases better. Yes, we are into a cold wave. It has been chilly. It has been tough weather and tough COVID. But I think we have been able to ward off the third wave very efficiently, unlike many other countries. Predominantly, we followed a South African pattern where it was explosive, tsunami-like wave, very contagious. A lot of households got affected. Very few needed hospitalizations and oxygen. Unlike United Kingdom or United States, where the Omicron wave hit on a delta, and therefore the jeopardy was high, and there was a large proportion of unvaccinated population there. So I think we have done better, and we need to be vigilant over the next 2 to 3 months as we restart our lives. I am thankful to Dr. Pandit that despite of his busy schedule in Australia, he joined us at midnight or past midnight. And I'm also grateful to Dr. KK Agarwal and IJCP group for continuing this Dr. KK Med Talk. Until we meet again next week for the Jopa show, I'm certain that you will see another Dr. KK Med Talk tomorrow, as the show must go on. And very clearly, we are living with COVID. We need to live in a COVID safe environment, COVID safe world, and gradually we are inching towards that. Thank you so much, and stay safe, stay happy, stay healthy.
Thank you, sir.